I used to work 60-hour weeks as a nurse. Now I make triple the salary working from my home office. The secret? Something that was right in front of me the whole time. Let me take you back many years. I was working those brutal 12-hour shifts that often stretched into 14 hours. Night shifts, weekends, holidays, you name it. I was missing birthdays, canceling plans with friends, and honestly, I was burning out fast. Sound familiar? If you're a nurse, doctor, or any clinical professional watching this, you're probably nodding your head right now. Here's the crazy part. I loved healthcare. I still do. I went into this field to make a difference, to help people, but the system was crushing me. Maybe you know somebody who feels it too? What I discovered changed everything. The skills I already had, my clinical knowledge, my understanding of healthcare workflows, my ability to translate medical jargon, were incredibly valuable in a totally different part of healthcare. Digital health. Digital health companies are desperate, and I mean desperate, for people with actual clinical experience. Why? Because they're building the future of healthcare, but most of them have never spent a day in the hospital. Think about it. All those frustrating electronic health record systems, those clunky apps your hospital uses, they were probably built by brilliant tech people who have zero clinical experience. That's why they don't work well in the real world of healthcare. This is where you come in. Your clinical experience is actually your superpower in digital health. You understand what works and what doesn't at the bedside. You know the challenges patients and providers face. You speak the language of healthcare. Let me break down what digital health actually is. It's any technology that improves healthcare delivery or makes it more efficient. This includes electronic health records, telehealth platforms, clinical decision support tools, healthcare apps, and digital therapeutics, health analytics, and AI solutions. And here's what's beautiful. You don't need to be a tech genius to work in this field. There are so many roles that value your clinical expertise first. As a project manager, you can lead teams implementing new healthcare technologies, making sure they actually work for real clinicians. As an analyst, you can evaluate healthcare data and turn it into actionable insights that improve care. As a trainer, you can teach other clinicians how to use new tools effectively. As a testing specialist, you can make sure healthcare software actually works the way it needs to before it reaches patients. When I made this switch, 3 things changed immediately. First, my schedule became predictable. I worked Monday to Friday, 9 to 5. No more nights, no more weekends, no more holidays. Second, my impact multiplied. Instead of helping a handful of patients each shift, the digital health solutions I work on reach thousands of patients every day. Third, and yes, this matters, my salary literally tripled. Not at first, but it did. Digital health companies value clinical expertise and they're willing to pay for it. Plus, many of these roles can be done fully remotely, which means no more commuting costs. Now, I'm not going to sugarcoat it. There was a learning curve. I had to learn some new terminology, understand the tech development process, and figure out how to translate my clinical knowledge into this new environment. But here's the secret most people don't realize. The hardest part of working in digital health is understanding healthcare, and you've already mastered that. The technical skills can be learned, often in just a few months. Digital health isn't just growing, it's exploding. The pandemic accelerated telehealth adoption by years. Hospitals are digitizing everything. Health apps are becoming mainstream, and AI is being integrated everywhere. And they all need people who understand actual healthcare. But what about patient care? Aren't you abandoning patients by leaving the bedside? This was my biggest worry too. But think about it this way. By helping build better digital health tools, you're actually improving care for millions of patients, not just the ones you see in a single shift. In digital health, you're addressing the systems level problems that frustrated you at the bedside. You're building solutions that make healthcare more accessible, more efficient, and ultimately better for both patients and providers. So what does it mean for you? If you're feeling burnt out in your clinical role but still love healthcare, digital health could be your path forward. Your clinical experience is incredibly valuable. It's the foundation you need to succeed in this field. Everything else can be learned. Imagine having weekends free again. Picture yourself making a bigger impact on healthcare while taking care of your own well-being. Think about using your clinical knowledge in a way that's valued and well compensated. That's the reality of digital health. It's not about abandoning healthcare, it's about transforming it from a different angle. And the industry desperately needs more clinical voices like yours to guide this transformation. If you're ready to explore how your clinical experience can translate into digital health, I've put together a free guide with the exact steps I took to make this transition. Click the link in the description to download it now. And if you have questions about switching to digital health, drop them in the comments below. I read every comment and I try to respond to as many as I can. Don't forget to subscribe and hit that notification bell so you don't miss your next video on the specific skills you need to highlight in your resume when applying for digital health roles. Thanks for watching, and remember, your clinical experience is your superpower. It's time to use it in a way that serves both patients and you.